Good afternoon. I'm Kim McCoy-Wade, the Director of the California Department of Aging, and I am so grateful to all of you who were able to join us as we have another in a series of our partnership webinars. This one, our second one, focusing on the digital divide among older adults. Really part of our larger theme on staying connected. In so many ways, digital literacy is one of the key tools to combating loneliness and isolation, and absolutely needs to be available to all of us across the lifespan, across the state. We have a terrific packed panel, so I'm going to make my usual appreciations and warm up even shorter than usual, but I just can't miss the moment to mark the moment where here we are in the middle of a pandemic where older adults and others with medically vulnerable conditions are being asked to stay home longer than ever. And we know what that means, how important it is to be connected, whether it's for the telehealth, whether it's for the video chat, whether it's for content, for entertainment and exercising, whether it's for meeting with your congregation or your book club, whether it's for volunteering. All of those connections are critical to health and well-being, to purpose and meaning. But we know that's not available to all. We know there are gaps in broadband access. There are gaps in access to hardware. There are gaps in accessibility, gaps in learning how to use these tools as they constantly change. And those gaps can grow and have even more disparities across our age. About 1 in 4 people in their 60s are not using the internet, according to the California Health Information Survey, the interview survey, excuse me. And that gets even higher as we get over 80, the majority, 56%. So those gaps are real, and of course they have further impacts among income and often urban-rural too, as broadband access can be a challenge. So the good news is there have been people hard at work on solutions to this and have lots of great programs and partnerships and ideas and innovations aiming for all of us, including people with limited income, people limited English. There really are, all those barriers are real, but there are strategies to overcome them, and join us all online. We've been very lucky to be advised by San Francisco and indeed California and national champion Shireen McSpadden on the great work that's been happening in San Francisco around technology and equity. And so she has suggested to us this great team of people who we're delighted to have with us. I'm first going to introduce Paolo Salta. Paolo works with Shireen at the San Francisco Department of Disability and Aging Services, really part of an extraordinary team on a normal day, and just setting the bar so high for all of us in these extraordinary times of COVID response. So I'm so grateful for your leadership day in, day out. And then they'll be followed by partners from SF Tech Council, Community Living Campaign, and Community Tech Network. And they are going to introduce each other and keep it going that way. But I do just want to take a moment to thank Paolo Salta, Carla Suamala, Marie Jobling, and Cami Griffiths, all for taking the time out to share their time, their talents, their expertise, and their commitment with our broader California community. With that, I'll hand it to Paolo. Thank you.
Thank you, Kim. Thank you. Thank you, Kim. Good afternoon, everyone. Again, my name is Paolo Salta. I'm an analyst with the Department of Disability and Aging Services. Next slide, please. So first, I'm gonna talk about the SF Connected program here in San Francisco. Next slide, please. SF Connected program here in San Francisco. Back in 2011, the city received a federal grant to increase technology access. The Department of Disability and Aging Services received half of that funding to implement programming for older adults and adults with disabilities. That funding allowed us to create and establish technology labs where older adults and adults with disabilities congregate. So that's senior centers, community centers, senior housing, affordable, supportive housing, and we actually have a few computers in adult day health centers and adult day service sites. That funding also allowed us to then also furnish those labs with computers, peripherals, furniture, and really provide a reliable, strong broadband internet. We know that in the digital world now, internet access should be seen as a utility. So we wanted to make sure that there's great connection with those computers and Wi-Fi is available for anyone bringing in their own devices. And lastly, the biggest component of that funding allowed us to partner with community-based organizations to provide digital literacy training. Next slide, please. In San Francisco, we always are very cognizant in making sure we're accessible, especially linguistically accessible. So when creating the computers, we have 200 computers to now 51 computer labs throughout the city. Those 200 computers are outfitted with 5 different language users. So when a student walks into a technology lab, they turn on the computer, they see 5 different language users they can choose from. So that's English, Chinese, Spanish, Russian, and Vietnamese. And when they click through, the operating system is then translated to that particular language. We also wanted to make sure there's a touchscreen capability to the computer. We know that some folks have issues with using the mice, so they might prefer just touching the screen. And now we have tablets and smartphones. So that's just, going with the theme of transitioning to new devices. And we also have a very big Chinese population. And so the touchscreen capability of the computers allows them to be able to write in characters when they're writing a letter on Microsoft Word, or writing an email, or just simply navigating through a Chinese website. And lastly, every single computer were outfitted with a large text keyboard. We chose to purchase Zoom text keyboards. And early on in the program, we actually subscribed to Zoom text software, which allowed low vision or blind participants to navigate through the computer, open different programs, and navigate through the internet effectively. Next slide, please. As I mentioned before, so the federal funding ended in 2013, and through advocacy and great work from our partners and from the community, the city saw value in continuing digital literacy and access. And that funding has continued on, and the continued funding has allowed us to partner and continually partner with community-based organizations. So that's Community Living Campaign, Community Tech Network, who you're going to hear from today, Connor House Inc., who is our one organization that's providing support in our affordable housing sites. Self-Help for the Elderly is our one big organization that's primarily focused on serving the Asian and Pacific Islander population in San Francisco. And lastly, Lighthouse for the Blind. They're really focused on providing resources to folks that are low vision or blind. Next slide, please. Our computers are accessible, linguistically accessible. Of course, our instruction is also linguistically accessible. So we have instruction in English, Spanish, Russian, Cantonese, Mandarin, and Vietnamese. And early on, we really want to provide a more structured class setup. So we have workshops that would bring a participant from very basic learning how to turn on a computer to then maybe opening programs and creating an email account. But as we progress on from 2011 to now, one-on-one training is really the most effective way of supporting folks. Again, these technology labs are set in places where people congregate. So there's meals programs. And so they can simply come in and get support with a trainer there available. Content, again, ranges from beginner to advanced computer basics to knowing how to navigate the internet. Social media, learning how to use Facebook, Twitter, Skype. WeChat is very popular also. Online safety security is always sprinkled through all the different trainings. We want to make sure older adults and adults with disabilities that know how to navigate safely, know how to identify things. CTN, Community Tech Network, actually also provided a series of classes about misinformation, right? Identifying things that may not be true, and drilling down and making sure that whatever you're reading is reliable. Lastly, assistive technology. Operating systems comes with a suite of accessible features, and they're not really just for folks that are disabled. It really is a benefit for everyone. So our partner Lighthouse for the Blind also carry out these train-to-trainer sessions to teach our other CBO partners and other trainers And as we progress through other operating systems like Windows making updates, or Facebook creating, or sorry, iPhones and Androids creating more accessible options, Lighthouse for the Blind is able to then provide more thorough training, more hands-on training to our partners and our trainers. Next slide, please. So what are we doing now as we shelter in place? I'm going to highlight two of our partners, Self-Help for the Elderly and Lighthouse for the Blind. Next slide, please. Self-Help for the Elderly took it a little bit slower than all our other partners. They started 2 weeks ago. They piloted a 60 to 90 minute virtual class with a current cohort of advanced tech students. WeChat is a very popular app with the Chinese population in San Francisco because WeChat is the most popular app in China, and they use that application to communicate with friends and family back home. And so they use that as a proxy app to then introduce Zoom. Through the WeChat app, they're able to then communicate how to download Zoom and how to use Zoom. And Zoom is going to be the one main platform that they're going to use to expand activities virtually. Next slide, please. Lighthouse for the Blind, since we sheltered in place, they continued to provide training remotely. The preferred setup for Lighthouse Lighthouse staff is for the client to have 2 devices, of course. And I think it's a preferred setup right now. We see a lot of people seeing this challenge as they try to train someone how to use a device. So a preferred setup is 2. One device is for someone to use to communicate with the trainer. And of course, the other device would be the one device that you would be learning. And then the organization they've been holding these Tech Together group discussions. It's really a sharing of information that is relevant to the current situation. And they've gotten very popular. They have 30 to 50 participants every week. And with internet and the sharing of activities online, it's really expanded out outside of San Francisco. It's expanded to the Bay Area, and I believe also statewide. So a lot of people are really jumping in and joining these sessions. And during these sessions, they're really discussing how to order food online, communication apps. There's so many now. But of course, looking at it at a lens of someone who might be low vision or blind, entertainment that are available now. And at the end of these sessions, a resource sheet is also shared widely to all the participants that attended. Next slide, please. Great. So next, I'm going to turn it over to Carla. Carla Sumala is a project director for the SF Tech Council. Along with her colleague, Andrew Broderick, Carla's area of expertise is educational technology, and she also serves as principal in her own consulting firm, focusing on issues related to aging, disability, and tech. Carla?
Thanks, Paulo, and thank you to everyone else on this call today. It's so great to have so many people joining us. I'd like to begin by telling you just a bit about the SF Tech Council. The SF Tech Council, which officially launched in April 2015, was formed to advance digital inclusion for older adults and people with disabilities. It's actually the first organization of its kind in the United States. We know that other cities are interested and some have reached out, but I think we're still the only ones. Today, the Tech Council membership includes leaders from over 25 private businesses, city agencies, and community-based organizations, as well as from academia, philanthropy, and healthcare. In addition, we have a wide network of supporters and friends across the city of San Francisco and in the Bay Area. Part of our work revolves around identifying and pursuing supportive policies and funds that are needed to achieve digital inclusivity. We also spend a lot of our time building cross-sector collaboration in the areas of expanding access and literacy, increasing training and employment, and reducing isolation and loneliness. One of the key factors that we are working with is trying to break down silos. We have so many great organizations in San Francisco, all trying to do good work. the SF Tech Council is trying to bring them together to solve some of these issues that are much greater than any one of us or any small group of us. The SF Tech Council is funded by the City of San Francisco and also by the Meta Fund, and it's coordinated by Community Living Campaign. You'll be hearing from their Executive Director, Marie Jobling, in just a few minutes. All right, next slide. In April, or actually just a few weeks ago, the Tech Council conducted a survey of our member organizations and supporters. We wanted to learn more about how they were responding and innovating in the face of COVID-19. And thanks to my colleague, Andrew Broderick, who was critical to pulling this info together. Next slide. Oops. Against a backdrop of high priority needs that many of you know all too well at this point, they include social isolation, access to healthcare, and remote training. Against this backdrop, we asked 3 questions. Next slide. First, what strategies, resources, and practices has your organization deployed in adapting, enhancing, or expanding services? Second, what impact have digital channels had on your programs, clients, and staff? And finally, how will COVID-19 impact how you organize and deliver services in the future? In other words, is there anything from this experience that you'll bring with you as we move on and beyond, although that's seeming a lot slower than we would have liked. Next slide. Among our key findings, respondents pointed to 4 different areas. The first one is the limited resources that they have to develop capacity for digital services. So this came upon us so quickly, the pandemic, that we have all sort of been left scrambling, at least at first. And we all have limited resources to respond and react. The second is staff being redeployed for other tasks, such as more IT, more online meetings, and more client interaction, usually by phone and sometimes by Zoom. We've also learned quickly that more tech use by clients and staff requires more tech support and more training and more time. Finally, our organizations or respondents have discovered some new issues that they didn't have to deal with before, especially when they were working in person. Key among them is secure communication of personal information, especially when it's shared across networks, and how to secure that sort of data for organizations that really haven't had to do that before. Next slide. The bottom line is that the digital divide is real in terms of internet access and personal tech use, something which many of you are running into daily. Next slide. We see the digital divide in the barriers faced by clients. First of all, there's a significant lack of digital devices available to those in the populations that our organizations serve. This ranges from smartphones to tablets to computers, either laptop or desktop. Even as there's been a nationwide push to make sure that K-12 students have devices, there's been no corresponding effort on behalf of older adults or people with disabilities. Second, many San Franciscans have limited or no internet access at home. Even in the tech capital of the world, more than 100,000 residents have no broadband access at home. And in this mix, low-income older adults and people with disabilities are among those most impacted. Finally, levels of digital literacy are correspondingly low, and people are struggling to use their smartphone applications to log on to platforms like Zoom, or even to use things like FaceTime, much less access medical records or use telehealth. Next slide. We also see the divide and barriers faced by providers, especially in these areas. Having personnel or the number of people with sufficient tech skills to meet the new demands of doing everything online. As I mentioned earlier, many of our organizations are very human-centered, and a lot of their interactions have happened in person. With the pandemic, that has changed entirely. Finding personnel with the language skills to teach tech skills to clients, whether it's Spanish or the Chinese languages, is also a real challenge. It was a challenge before, and it's even more of one now. And finally, there's a lack of infrastructure in many of our organizations, whether it's hardware, software, expertise to function in this new normal. And those things cost, which again is a barrier we keep running up against. We've realized that some of the basic issues around access and literacy have been around for years, but they're more pressing now. And when getting online is no longer optional, it's a basic necessity, as Paolo pointed out. The SF Tech Council is working with members and supporters to innovate and develop solutions in these areas through collaboration, partnerships, and seeking new funding sources. At this point, you can move to the next slide. I'd like to introduce you to Marie Jobling. She's the Executive Director of the Community Living Campaign. She is also on the steering committee of the SF Tech Council and a co-chair of San Francisco's Dignity Fund Coalition. Marie has been involved for her entire career in San Francisco, working on projects that focus on community building, empowerment, and advocacy for older adults and people with disabilities and their hands-on care providers. Thanks, Marie.
Hi, here I am again.
There you are.
It helps you. A little thing pops up and says, please unmute yourself. So the Community Living Campaign was launched about 13 years ago. And our motto at the time was cultivating connections to help seniors and people with disabilities age and thrive at home. And we didn't realize how prophetic that would be now 13 years later, especially the age and thrive at home part. So and over time, you know, we have developed activities that grew in various ways, reweaving community at the neighborhood level, particularly in neighborhoods where there wasn't already a senior center or a community site. And those activities included exercise programs, workshops, writing groups, tech help desks, social activities, and much more. So when the stay-at-home orders came, we at least had a base to build on. So in a minute, I'm going to tell you where we are now, but I think I want to say a little bit about how we started and how we got there. Next slide. So as you've already heard, San Francisco was fortunate in that we got a BTOP federal grant in the beginning. And as a part of that, CLC was enlisted by the Department of Disability and Aging Services to host a special summit at City Hall. This is our third organizing event, and this one was focused on aging and disability. Over 700 participants streamed into City Hall for a day-long event that included high-level speakers, workshops, demos, hands-on support. And you can even still see videos of the event on YouTube. Now, in doing this, we had to deal with all of the issues for the first time, many of us, in terms of how do we make everything accessible? How do we make the language capacity for anybody who wanted to come available? How do we get Wi-Fi into every corner of City Hall, where the event was held? And we also had to bring in 50 computers and hook them up so we could do hands-on demonstrations and have our own little community lab right there in the middle of City Hall. So by doing this, we actually, for the first time, kind of introduced to the wider community the issues. It gave us a chance to look for the folks who care about digital inclusion and introduce them to one another. And by bringing 700 people to City Hall, our elected officials noticed what brought them, the issues that brought them there, and the fact that this is something maybe that should be paid attention to. Now, we just did the big summit, but in truth, over time, the library kind of picked up the gauntlet and now has been doing, not this year, but in past years, a Connect with Tech Week that does the same sort of thing, bringing people across the city together to learn about how technology can enrich their lives. As you heard, next slide, as you heard from Paulo, we started with some good federal funding, but then that federal funding ran out. And so at that point, we launched the first of 2 Keep Us Connected campaigns, really with the goal to convince the city and county of San Francisco to pick up the funding, to keep the computers running, to keep the tutors and trainers teaching, and to at least hold the line and continue to try to build a bridge across the digital divide. Again, by taking the issue public with postcard campaign and trips to City Hall and a social media presence, we again made it a public issue. And in the process, we interested Comcast, and they stepped up not long after to fund several of the organizations that have been involved in SF Connected to do some additional outreach and to help shape their Internet Essentials program for seniors. So, you know, but it was a really hard campaign. Next slide. And it became clear that we needed a bigger army. We needed to have more support and stronger stakeholders who had really the interest in digital equity and who saw the importance that digital access will be for healthcare providers, for elected officials, for families, and hence the Tech Council was formed. And really the first little seed money for the council came out of that SF Connected campaign. Next slide. So where are we now? Oh, we're kind of tired, but in the last 7 weeks, we have virtually taken all of our community connector programming, that's all the things that we were doing in churches and neighborhood sites across the city, and moved them online. The only one that still is on the ground is grocery delivery, but everything else has gone online. So it's workshops, it's exercise programs, writing groups, social activities. You know, the list is very long now. In fact, we're at the point where we have about 24 diverse offerings every week via Zoom. And our staff has gotten much better at teaching on Zoom, tutoring, being able to manage a Zoom call, and to use outreach through Zoom and social media to get people kind of into the group. Now, some of the sessions are small and intimate. I'd say that writing groups, one, pet social hour, that one was an easy one because every time we did a Zoom call, the people's pets would find their way into the screen. So we decided, let's just make it about them. We also have a Dr. Anna Chodos, who every Friday has a chat with people about the coronavirus and the new news and really answers people's questions from older adults. Some of our sessions are really large. Ones on public transit have gone up to almost 100. And we have one, our current record is a session with 150 people in it. I don't know if you want to try to guess what would be the draw for something like that, but it was rock and roll history, because this program needs to reach out to seniors of all ages, and this was a really good one to bring in the boomers. So, you know, at the end of the day, the classes that we put up were really about finding the things that people are interested in learning, the things that people are interested in teaching, and the ways that an online platform can help bring them together, as well as suggest activities that folks can do to stay connected outside of computer land here. So I think that, you know, the last thing I wanted to mention was about the digital passport program. So in the process of trying to find our way as a digital literacy organization, we worked with the Tech Council to come up with something called the Digital Passport. And it is a really kind of fun and interactive way for seniors to identify the things that they could learn online and to be able to use the computer and when we had hands-on tutors next to them, but now just the computer, to be able to access sites where they could learn about shopping online, about crafts, about transportation, all of the things that folks need to learn at some point. And so the Digital Passport program was a way to do that online. And we included fun features like bingo, Digital Passport bingo, and prizes for those who got enthusiastic about being digital travelers. So the information I would say about CLC's current activities and the ones that have gone online are on our website, which is, there's a link at the end of this presentation, and the Digital Passport material, which is available in English, Chinese, and Spanish, is available on the SF Tech Council website in the resources section. So with that, I'd like to introduce the next speaker here, which is Cami Griffiths. Cami is the executive director and co-founder of the Community Tech Network. With over 15 years of experience working in the public sector, Cami has developed a passion for helping people gain access and better utilize technology. She's a founding member of the National Digital Inclusion Alliance and speaks nationally about digital inclusion. So welcome, Cami, a fellow traveler and really a leader here in San Francisco and beyond.
Thank you, Marie. Such an introduction. And yeah, fellow traveler, I hear that. It's been a decade pretty much since we've been working together. So I am the executive director and co-founder of Community Tech Network. And today I'll be talking more in depth about a new program we've launched called Home Connect. Next slide, please. So just a little bit about our organization. Our mission is to transform lives through digital literacy. And our vision is a world where all people understand the value of the internet and have the digital skills and access needed to accomplish their goals and improve their quality of life. Pretty lofty, but we're working hard to help make that happen. And our work has always been about digital literacy, and we've done it in different ways over the last 12 or 13 years. And this virus has forced us to completely change how we deliver our work. And we were somewhat prepared, but still, it's been quite a shock and a little exciting too, to see us be able to expand beyond the partners that we would normally work with, like senior centers, and be able to get referrals from our senior centers to the clients that they serve. So in this picture here is my coworker, Sabrina, who has one of the tablets that is being delivered to some folks at the Alameda housing apartment development in San Francisco, which I'll talk more about our process for that in a few minutes. So next slide, please. So the Home Connect program is our response to the need that we saw emerge when people had to go home and stay home. And we knew that there were a number of opportunities for people to engage online, but you can't engage online if you don't have the internet or device or the skills. So we felt that the best way to pivot our work was to focus on getting people the home connectivity that they needed. And we knew going into it that it's one of the hardest things to do. So what we're doing is taking referrals from our partners and providing those referrals with home internet access, an Android tablet, and online training. So I'll talk more in depth about all of that in a minute. Next slide. But prior to COVID, what we were doing, as I mentioned, is working in partnership with organizations across San Francisco and really the wider Bay Area. We are one of the SF Connected training partners, so we would provide trainers, most of whom are bilingual, throughout 20+ locations in San Francisco. They were doing one-on-one tutoring or small group instruction when we could get enough seniors together who spoke the same language and were interested in the same topic. And all of that instruction was happening on the computers at the senior centers that were provided by DOS. And lately, as in the last couple of years, more people were bringing in their own devices, so their phones or their tablets, or even bringing in their laptops. And so our volunteers, so we have both paid and volunteer instructors, and they were having to answer questions on people's own devices, or BYOD, bring your own device. So that's what we were doing before. And then once all the senior centers closed and our staff had to stay home, it was quickly pivoting to helping people remotely. So in addition to Home Connect, we are answering questions by phone, and we're not promoting this. They're just, people are finding us, senior social workers are calling, they're emailing our info at email address, they're calling my cell phone, somehow they get my cell phone, and they're saying, I need to know where I could go for computer access. I don't have that any longer, the library's closed. And I would say, well, there is no place. So in some cases, we've provided donated devices to individuals who contact us, most of whom are seniors or people with disabilities. We're distributing devices, we're lending hotspots, we're providing phone support. One of my staff members helped somebody. It took 3 hours a couple of weeks ago to figure out how to get him back on WeChat, that he wasn't able to log in. And it's just, it's hard work to get people to the place where they can independently and safely use the internet. And the other thing we're doing in partnership with Curry Senior Center, one of our partners in San Francisco, is they were delivering a series of classes for a program they have called Senior Vitality, and they didn't want the momentum to slow. That this program was to help people use iPads and other wearables for health outcomes. And so instead of in-person training, they asked our training staff to record those sessions on, record them and put them on YouTube. So we have 3 people on our staff that are now recording their training sessions and putting them on YouTube, and they're finding it much harder than you'd think. It's hard to be succinct while recording something, and then you mess up and you have to start over again. So we're learning a lot in that way. So next slide. So here's the Home Connect workflow, and it's helpful to see it visually. I'm a visual person, so I'm like craving, like, how do we see this? Because it's such a big thing. And it's not a big thing if you're doing 1 or 2 people, but we have enough funding to help 100. And I am hoping to raise money to help 1,000, or as many people as I can as an organization, the I being Community Tech Network, and our partners and whoever else will, try to launch this program in their community, that we know that there are thousands of people who have limited to no access. So what do we do to get them the access that they need? So we're taking in referrals from partners, and I'll talk about the ideal referral in a minute. And then after that referral, we make a phone call to just introduce ourselves and to say a little bit more about the program, make the senior feel comfortable. Sometimes they feel like this is a scam, like, why would you be giving me a tablet? What's the catch? How much is this going to cost? So we really try to set them at ease and say, no, this is part of our partnership with the city. We really want to help you get connected. We understand there's barriers that you face, and we want to help you get over that barrier, one of which is the internet. It is so challenging for to navigate the phone system at some of the internet service providers. You're on hold for an hour, you lose your connection, you have to call back. It's very frustrating. So one of the pieces of this puzzle is identifying if they have internet or not, and if they do, they can proceed to getting the tablet. If they don't have internet, then we have a dedicated staff person who is helping the senior through the entire process. Often doing a 3-way call with the service provider and prepping the senior to make sure they have all the paperwork ready to show their eligibility. There are several low-cost options. I know that SF Tech Council has a list on their website for the Bay Area, and other tools like the National Digital Inclusion Alliance that I'm on the board of, their website, digitalinclusion.org, I believe is the URL, has a list of low-cost options across the country. So definitely, if you don't know about the low-cost options that are out there, check those out and ensure that you're providing information about those low-cost options to your community. But the act of connecting someone to the internet can be very time-consuming. And we're also committing to pay for 3 months of service. So logistically, we're having them send us their first bill, and then we'll pay for 3 months in advance. And that's part of some fundraising we've done to get money in the door to help pay for this and to pay for the tablets, because per the city's funding, there's a rule against paying for devices that get kept by residents. And so I honor that. And we've been able to raise money, other fundraising to pay for those tablets. So tablets are in short order. It's hard to find the ones that you want. So if this is something you're interested in pursuing, I would say, try to purchase the tablets that you want, or the devices that you want quickly because we're finding that the ones that we want are out of stock. And what we've chosen are Android 10-inch with an operating system that works well with a program called TeamViewer. And it's TeamViewer that we use as the screen sharing program. So our learner or our trainer will call the senior and help them get connected to TeamViewer so they can share screens. So that's the tablet is shipped to them with the learner booklet that we've created. That is the place where, you know, a lot of folks want to have a piece of paper in their hands and something to refer to and write notes on. So we always have the learner booklet. And then once they've received that, then our paid staff provide 5 one-hour virtual training sessions. And I'll go over the curriculum in a minute. And then after those sessions, they'll get handed off to a volunteer who will then continue to work with them over the course of 3 months, ideally minimum 3 months. So next slide. Here's a breakdown of what we're covering. So on the left is our initial 5-part training, getting to know the device, searching on the internet, intro to email, safety, and then using the camera. There's a bunch more in there. We really wanted to give the learner enough information and confidence so that they would be able to work with the volunteer in a more productive manner. We wanted to make sure that what we were delivering to the senior is fun and that they would enjoy working with our trainer and that they're learning tangible skills that they will use right away. So how do you do video chat with your family? Well, you need to identify what platform your family uses and then you get their information and so you can connect. So by the time they're done with those first 5 sessions, at the very least, they're able to plug it in and charge it, turn it on, interact, swipe, all that stuff, but also being able to do video chatting with family, being able to search some things online so they can watch YouTube videos if they want to. And safety is critical, so we definitely focus on safety and ensuring that they're not disclosing any kind of personal information and understanding what to watch out for. Once they're handed off to the volunteer, and by the way, we're testing all of this out. Like we only have 1 person who's gone through the entire 5-part training. We have about 5 more in the pipeline of being at some point in that 5 parts. And so we haven't actually officially started our one finished learner with her volunteer yet because she didn't show up for her session that was 2 days ago. So we're testing this out. It may flop, so we'll see. But as of right now, we've identified 5 learning pathways that we feel are most of interest to the communities that we've been serving. And we're providing some framework for the volunteers to follow and some guidance on how to run the hour session with the senior. So as they get passed on from a CTN trainer to the volunteer, the trainer has already said, okay, Vivian is very interested in ordering groceries. So that's what the focus will be. So we've created a cheat sheet of sorts for each of these pathways that says, you know, first ask what they're interested in learning, and then you will have to get over the barrier of setting up the account, but really you want to get to the meat of doing the thing and practicing the thing, which is ordering groceries or filling out your census or doing a search or logging into your health portal. And then as far as the 1 hour time frame, the first couple of minutes are just, how are you doing? You know, how are the grandkids? You know, how are you feeling about this, and checking in and really trying to ensure that this is a personal relationship that you're building, that you care about their advancement. And then you jump in to the activity and you do some activities and then you review. So, you know, like I said, we're testing this out. What we are creating are booklets for everything. Screen grabs and handouts, it's time consuming, and the second an app changes, it's no longer accurate. So we're not doing that, and we might learn that we need to do that. So check me in like 2 months and I'll tell you how things have progressed. So next slide, please. So our ideal participant, and we've learned a little bit the hard way on this because we've been trying to get folks who already have the internet and many people don't. So we've had to kind of bring people on board who perhaps don't have great desire and motivation to learn, or they have health issues that are making it challenging for them to focus on learning. So in a perfect world, our partners are referring an older adult who lives alone, who really wants to get online and learn how to use a tablet, and that they currently have limited or no access to the internet. And then we feel we'd be making the most impact and be most likely to succeed if we have this type of person. And limited to no access to internet, what we're finding is a lot of folks are using Lifeline phones, and they don't really understand that that's a smartphone, and they could be doing some internet already on their smartphone. And there's just a huge amount of questions and confusion around the internet. So, you know, if someone has already touched and tapped and swiped, then at least that's one barrier that we don't have to worry about. But we're willing to work with anybody who is really excited to learn. Next slide. So we, cooked up this idea a little over 2 months ago. And thankfully, the Department of Disability and Aging Services said it was okay for us to do this. And we had some check-in calls with several of our partners to see, hey, is this something your clients would benefit from? And everyone was like, yes. And so to date, and as of today, there might be a few more referrals, but we've had 73 referrals made to us. And I know there's more people that the partners haven't yet referred. And I think that the sticking point is the seniors think it's a scam, or they wonder what the catch is, or the staff of the nonprofit partner isn't really aggressively talking to their clients about it because they think it's a scam. So we're kind of trying to work through showing that this is a valid program. And I think we'll do that by collecting the stories of the people who have succeeded. So 73 referrals to date, at least 15 who need internet, but there's far more than that. We have a bunch of referrals who came in that are Spanish speakers, and the person who's doing kind of the initial intake calls doesn't speak Spanish. So we're having to train someone who does speak Spanish on our staff to make those calls. So there's about probably 30 more people who should be added to that list of needing the internet. And then we've shipped 6 tablets, and I think there's 4 more that are shipping this week. And those who are currently in the process of training are 5, and then the completed woman 1. So she ended last Friday. So hopefully she'll be able to work with her volunteer soon so we can start to see how that process is working. And I just feel strongly that the 5 initial 1-hour sessions is just barely scratching the surface. That's just giving them enough to be curious, to be a little bit more confident, to ask some questions, and that it's the volunteer that can work with them over 3 months that will really get them thinking, oh, how do I do this? Oh, I heard about this website. Can you tell me that? And that's the kind of back and forth that we have already seen in the SF Connected labs, that people would bring their list of questions and they would work one-on-one with our volunteer in the lab. We're trying to replicate that online. Next slide. So while we are doing this in San Francisco, it's something that could be delivered anywhere in the country if you have enough funding for the devices and a network of service providers who have connections to seniors in need. So I would encourage you to reach out to me if you have any questions or if you'd like to partner. I kind of consider what I've learned like public knowledge, like steal my ideas, that there's so much need that like we're not in competition. We're in competition against the clock, right? Like we need to get more people connected now. So anything I can do to be supportive, reach out to me. And thanks for the opportunity to be on this webinar. Thanks.
All right, thank you to all of our speakers. My name is Terry Shaw. I'm with the CDA Department of Aging team. And I really appreciate all of the wonderful information that's been shared today, and so does our audience. We have a lot of great questions. So I want to first of all encourage everyone who's listening who has questions to use the little Q&A function at the bottom of the page to just type in your question. And we'll do our best to answer some questions in the time that we have left. One of those first questions is, will the materials that were presented today be made available? And yes, we are recording this webinar. We will post the recording and the slide deck and additional resources on the California Department of Aging webpage. So please check back to that resource page that's listed there on the screen in order to find those materials. We hope to have them posted in the next day or two. And let me go ahead and start going through some of our questions. We clearly have a lot of interest in all of the different programming and efforts that were discussed today. And as an indication of that, there are a lot of questions about, are these services only available in San Francisco, or are they available statewide? And people are particularly interested in Southern California, it sounds like. So I wanted to ask our panelists about resources that actually may be available to anyone, anywhere, through the efforts that you're doing. And Cami, I know that you mentioned at the end there that even if they aren't currently available outside of San Francisco, they are potentially scalable to and extendable to other sites. So anyone from the panel who'd like to address the access issues out beyond San Francisco?
Sure. Let me start by saying, once we went online with all of this material, it really is pretty available for everybody. So all of the classes that we're now doing, while we want to focus on San Francisco and do outreach there, the truth is now we have people from all over. We had a call from somebody from Australia wanting to see if she could sort of join us for one of the sessions. So so there's no boundaries in the way that there used to be. I'd also like to say that the material that we've posted online about the classes, the workshops, all of that, as well as the digital passport program, that material is all available in different languages for any community to take and download. And you're welcome to it.
I'd like to add that if you're starting from scratch, so to speak, understanding the need is really important, in having data to show funders and policymakers why this is important, so they'll dedicate funds. So if you're in a position where you can work with several other groups and put together a task force, deploy some kind of survey, most likely you'll be making phone calls and logging those answers into SurveyMonkey or what have you, that from that data will be super, super helpful and actually just necessary, both to prove the need and then as a baseline for what you've accomplished. And we've done this over the years through San Francisco. We have a very lucky situation where the Department of Aging has funded us, and they continually do these surveys, and we know what the need is. But if you don't know what the need is, but there's a need, but you don't have data, start with the data. And I'm happy to share a survey that was put together based off of a couple of other surveys. And I'll work with the host to figure out how to get that out to the group.
I have a couple things from the Tech Council. As Marie said, before this was all so much more regional, we have regular meetings around aging, tech, and disability, those three items, and we bring in community partners every month to have a discussion, often with startups as well. And those are now open to anyone. So next week, if you go to our website at www.sftechcouncil.org, next week's meeting, next Wednesday, is on the medical or the digital divide and healthcare, and especially looking at vulnerable populations. And we've got area experts, including people from UCSF. So make sure you jump on RSVP and get your Zoom link.
I also want to share, in San Francisco, there is a digital equity initiative. It's a partnership between different departments. It's with the Mayor's Office of Housing and Community Development, the Department of Disability and Aging Services, Department of Technology. And there is a digital equity playbook that's available, and also a strategic plan that came out of that. So I will be sharing those two resources. They're available online. And if your county, your agency is looking to create a digital equity sort of programming, Cami brought up the point about surveys. So there's also a guideline in how to collect the information that you need to move forward to the next step. So I'll make sure to share that with everyone.
Excellent. Thank you all for your responses. And again, we will gather these resources and include them with the presentation and the materials from the webinar. So we will make those available. Let's see, there's another theme of questions here that is about differences in skills and experience with technology for seniors of different ages. And particularly people are pointing out that many baby boomers, for example, have used a lot of technology in their work lives. And so there are questions for you all about how do you take those different skill levels into account, and also to what extent does that indicate a pattern that you need to plan for the future, and how are you doing that? Thoughts about that meeting people in the spectrum of needs that they have.
Well, no matter where they are, I think everybody learns by doing. And what we've found is that people just need a reason to get on. If they haven't really felt kindly about using the internet or technology, the opportunity to stay connected with family, to be part of family celebrations, to be able to learn the news firsthand, that those are motivators, and that generally there's somebody in their family and hopefully in close proximity who can still give them a hand in terms of taking those first steps. And we find more and more people contacting us wanting to volunteer and be helpful. So it is a little more challenging to do this online. And we're fortunate in that we have a team of computer trainers, so we've just sent them out to call everybody who used to come into a lab and say, how are you doing and how can I help you, and do you have internet at home? And then they get involved in those really long conversations, helping somebody fix the password on their computer or something like that. But in the Asian community, it's all about WeChat, and that becomes kind of the tool to help people learn. Somebody asked about, do we have Zoom in different languages? We have a great presentation in English, and we're about to translate it, but our hope is to be there in a couple of weeks.
And I'd like to add the benefit of having a one-to-one volunteer or instructor, we're calling ours digital coaches, is that they help with exactly what the learner is interested in. So it doesn't matter your skill level. It's really, what do you want to work on today? Let's dig into that. And it could be, any number of things. I want to search for recipes, or I want to read the news, or I want to download this app. What's an app? How's it different than a website? And being able to have that person that you feel comfortable and you trust being able to open up and share that you don't know something. So I think that the sky's the limit, really, and the hard part is getting a digital coach, volunteer paid or unpaid, that can really help the person along in their journey and be their cheerleader and be like, you're doing great. And it can be frustrating when Google decides to update their interface for the 18th time, and we can all just commiserate together. So I think the one-on-one is just the best way for adults to learn. And people, like Marie said, really want to give their time right now. So the more we can engage people in service virtually to help their community, the more we can do to help each other.
I just wanted to quickly mention this spring, the Tech Council has worked with the Fung Fellows program at UC Berkeley, teams of undergraduates, and they have been working on precisely these issues with us and our member organizations. One of them is to develop a digital literacy assessment that is appropriate to older adults as opposed to what's out there. North Star is the most commonly used, and really focuses on individual needs and helps to assess what their level of ability is and also their interests. And so they are going to be presenting their findings in the next week or so, but we're hoping to continue on with that project and to actually roll out some possible iterations of that in the next couple of months.
I just want to add and kind of piggyback off of what Cami said. I think one-on-one support is, I think, the most effective way of training with older adults. Baby boomers, yes, are coming in, and digital, we have a lot of services that are becoming digital. There's that EVV transition that's happened recently. Everything is going to be available online soon. Resources, a lot of companies are providing videos online on how to do it, but with older adults, that's not really effective for them to sit down. So we need to train our trainers on new devices, on new operating systems. Those are going to be available for them to train, to get training from by the videos of those companies, and then we'll do the hands-on support with older adults and adults with disabilities.
Excellent. And I'm going to assume that there's a lot of we see that there's a lot of interest, people wanting to be able to volunteer. And I'm going to assume that as you all are pointing out the importance of one-on-one training and the importance of volunteers, that those baby boomers and others with more sophisticated technology skills perhaps already under their belt, they themselves can be the volunteers and be partnered up as part of these services. I assume that's part of the model. So I want to thank you all again for joining us, our panelists and our audience, and we will post these materials, and we will do our best to make sure we've got resources posted that answer the questions that we unfortunately were not able to get to today. But thank you all for joining us today, and we'll be back in touch soon.